Welcome, everyone. Thanks for attending our webinar today. My name is Marcy Timmerman. I'm the Executive Director of Mental Health America of Kentucky. Pleased to be recording this event for lots of folks. So Hannah Brosnan is our Finance and Operations Coordinator. She's also available should folks have questions or need a tech information shared. We are pleased to bring you a person-centered approach to trauma. Dr. Lee Look is with us today, and I'm going to go ahead and let him take over.
Thank you, Marcy and Hannah. I appreciate it. Hi, everybody. My name is Lee. I'm assuming you can see my shared screen. So I'm going to be referring to that. What I really hope is that we can turn this into some sort of a dialogue, either through the chat or on screen. If not, the alternative is me just going on and on about the stuff I want to say and not the stuff that you want to hear about. I think we're all smarter when we're conversing together than when one of us is conversing. I will ask your forgiveness as well as I try to show a video or two. If it gets clunky, just bear with me. If something's not coming through on sound or video, just let me know early on so you don't watch the whole video and then go, I didn't hear it or see it.
And we're sharing screen right now, just to make sure you know.
Cool. Thank you. All right, cool. So here's what I would love to know first is sort of the mix of an audience that we have. Half of this presentation roughly will be sort of geared towards people experiencing trauma, and half will be geared towards people providing services to people experiencing trauma. Thank you. I see a mental health advocate. Thank you, Marcy. And I think that we go back and forth, right? My background is pretty varied. There we go. Thank you, Marcy. Man, you are a policy. Thank you, Ms. Fitzpatrick. My background is I am a licensed psychological practitioner. I'm also been a firefighter for over 20 years, actually getting ready to retire this week, I think. And you'll soon see why. It'll come up during our conversation. So I sort of see things from the perspective of someone that experiences trauma and someone that serves people with trauma. That being said, I think through the pandemic, we have realized that there's a lot more of us that are victims of trauma than maybe we thought before, and consequently a lot more of us that are first responders than were before. This will come up throughout what we talk about as well. But I would argue that, yes, your police, fire, EMS, LG&E, or the gas and electric worker is a first responder. And I also contend that the 16-year-old kid at Walmart that's putting out Lysol wipes surrounded by grown-ups glaring at this person waiting to get their limit of 1 or 2 canisters, it would also be a first responder. The people that deliver the Amazon goods that we all ordered ad nauseum throughout the pandemic, what are we doing for those people, and are we recognizing them for the victims of trauma that they are? So that being said, let me go to the chat. I see there's a victim advocate, a finance and ops coordinator, developmental behavioral pediatric fellow, a targeted case manager. I think that's all that I've seen. Let me make sure I missed something. Oh, there's a student success coach, a victim advocate. There we go. Policy, mental health advocate. Okay, so I would put forth that all of you all in one way or another had to work during the pandemic and be out in the world that was shut down. At the same time, because you're out serving the people in the world that were also serving the world while it was shut down. So I think we'll be able to hit each other on lots of different levels on this. Again, I would love for this to be a two-way conversation. I would love to forget my PowerPoint and not get through a third of it, but it will be what it will be. If we get done early, that's fine with me. If we go till the full hour, that's also fine. And if you all have a direction you want this to go, that would be even better for me. So I will continue to move through it. If there's thoughts, use the raise your hand emoji on the screen. I can see all of your screens, but I can't see any of your faces, so I can't see if you're waving at me. Okay, so person approach to trauma, that's me. I work for St. Matthew's Fire and EMS. I also work for Cedar Lake Lodge, which is an intermediate care facility for people with intellectual and developmental disabilities. I'm the director of therapeutic services there. I also have a very small private practice in psychology. Not too long ago, I was on Twitter, and I got a little fed up with somebody who was kind of like saying, just kind of downplaying the pandemic and what it meant for people. And I don't know about you all, but when the pandemic started, I had one mask at the fire department. I used it for 3 weeks, and it was disgusting. I remember during the pandemic, the heroes work here signs outside of every long-term care facility, outside of every fire station, police station, EMS agency, LG&E office. Everybody that was out doing the job, they were the heroes work here signs. And so I got angry, and I sent this tweet here. Remember, heroes work here. Guess we all forgot that, huh? Forgot all the ways we need nurses, because as you all know, finding nurses during the pandemic was like finding a gold mine. And of course, I thought, whoever I was talking to, I thought, this has got to shut them down. This will silence them. This is maybe the tweet to end in this person's tweeting career. And instead, this is the response that I got. I remember the TikTok videos of nurses doing dance routines while we were told that hospitals were overwhelmed. You talking about those heroes? Question mark. And I lost my shit. I was furious. Of course, I can't respond, because what are you going to say to somebody that's their response after living through a pandemic? And it's that lack of perspective that we forgot. So it's somebody that has no awareness of what trauma is to people. We all went through it. All of you guys have been through it. And I don't know that we realize that we have. And so I want to talk a little bit as we go further about the differences between cumulative and acute trauma. I think one gets a lot of attention, and I think the other doesn't. And I want to make sure that we're all aware of that. So who is here? This, I think, encompasses quite a few of you. I noticed that there are some other categories that I could add, but I would put forth again that these are all the first responders that we're talking to. What are our goals? We want to define trauma through the pandemic, traditional responses to it, different responses to different types of trauma, the cumulative and acute, as I said, and then talking about some approaches to dealing with it. There's the horse to water adage. We can get trauma, victims give them the resources, but are they taking advantage of them? Are they utilizing the resources that you're out there providing? And then, so if we have time, some possible solutions. And again, we're going to talk about this from the perspective of both a clinician and a first responder. We all have different roles and different perspectives, but I would also say that we've all been first responders, and we have all been serving people that experience these traumas. Here's what we're not going to do. We are not going to trash the organizations that we work for, right? The agencies that we work for, the CEOs, the executive directors, they have an impossible job providing an unmanageable number of skills and services to a population that is increasingly in need. I know you guys are all being asked to do more with less. Your supervisors and your managers are trying to balance that. To expect them to know exactly how to care for everybody on their workforce's individual needs is too much to ask. So we're not here to trash the people we work for. They are doing the best they can. Here's what else we're not going to do. We're not going to ignore our current strategies, right? There is value in an EAP. There is value in informal debriefings around the water cooler, the picnic table, having drinks with coworkers. And we're not here to say that no one cares. People do care. They want to help. They just maybe don't know how. And that's big, right? They don't know how. All right. So who are we now? Let's see, I want to change something here, because this is frustrating to me. All right.
The toolbar? So what's bothering you?
No. I was just trying to put up the presenter view, because
Gotcha.
I don't know. This it's weird not being able to see you all. But it's okay. So who are we now? The current pandemic and the racial tensions we've been through have created a new class of first responders, as we talked about. It's not just firefighters, police officers, EMS personnel, nurses, and doctors. But think about your long-term care, your assisted living, your ICFs. Again, talk about your stores, your restaurant workers, right? I mean, I don't know about you all, but we would put to carry out several times a week, we would make sure that our bartenders and our servers and our people that worked in our homes were taken care of to the best of our abilities. It was a time of community that clearly hasn't lasted. We have moved on in this community, and there is very little of that empathy remaining, I think. As we mentioned, delivery drivers, teachers. I would say even parents that have had to deal with putting their kids in and out of school. We started the school year already this year, and schools have shut down.
Yep.
We are going back in it. I work in a facility that we implemented a new mask rule today because we have an outbreak. We've got multiple people that we serve here that are COVID positive. We've got many staff that are COVID positive, and we're getting ready to go into a staffing crisis within the next week, probably. We just have to hope that we get people back as fast as we lose them. I want to tell a story of a restaurant that I patronize. A woman walked into the empty restaurant. The bartender was there to pick up carry-out food, and she wasn't wearing a mask. And this was during the heart of the pandemic. She was the only customer in the restaurant. When the bartender asked her to put a mask on, she said, "Why? There's no one here." And his response was, "Well, we're here." So suddenly our restaurant workers are working in a hazardous environment. Our workers in meat packing plants working are even more hazardous environment. We're asking teachers to return to the classroom with no protections, asking other teachers to work virtually. Um, this is great in a way because now we're able to see trauma. We're shining a brighter light on it. It's definitely out there for us to work on, and it's not a taboo subject anymore. Something to consider. Um, when we talk about our organizations supporting us and talking about them understanding the need for working on trauma and our mental health, uh, I would say that you can learn a lot more about an organization's priorities, not from their mission statement, but from their budget. I'm sure that's not any news to you all, but if you come from the fire department, we have a very shiny truck in that bay that's got chrome all over it, and every tool that we could ever think of to need on there, and that's $1 million, and our EAP costs us what, $5,000 a year. But we value mental health, right? You look at every journal article, it's all about mental health for first responders or for
Providers
trauma
tend
victims.
to, yeah, we advocates tend to think that a budget is a moral document, no matter whether
Ah,
it's a
that's a way, that's a great way to
organizational
look at it.
budget or a larger one.
I like that. That's a great way to look at it. A moral document. I'm going to write that down for next time. Um, thank you. Um, what?
May I interrupt for just a second? I'm so sorry.
Please.
Um, if you click more at the top right of your toolbar there,
Uh-huh.
then try that, and then there should be one show video panel. It's in the second section
Look at that.
down.
Wow.
Can you
Hey.
see
Hi, guys.
everyone?
Here we
Oh,
Yay!
are.
Okay,
thank you. Thank
awesome.
you so
Thank
much.
you.
Wow. Hannah, thank you very much. And Mars, thank you. Yeah, a moral document is the perfect explanation for that. Um, are we asking our agencies, how are you monitoring our mental health? How are you training us to manage our mental health? And how are you helping us when we need help with our mental health? And if the answer is, well, here's the EAP's phone number, I would argue that there's more that we can do. So we will talk also about, come on, a person-centered approach, considering a client's unique circumstances and experiences, empowering them to help themselves, and all the other stuff we talk about, dignity and respect and positive regard, meeting them where they are. But I also want to make it clear that I'm not putting forth a therapeutic orientation with this conversation. We're just putting some things on paper that defines meeting them where they are. You all have your own orientations. You all have your own way of working with people. But I think this is pretty universal. We just want to make sure that we're not putting someone in a round hole when they're a square peg. So why do we do what we do? Well, I would say that all of you have your own reasons for doing what you do. I would say this is one of my reasons. Come on. I have my family, and I have my other family, and I have this. Uh, I don't. So a little bit about me. I don't have kids, but my partner has kids, and now I have a grandkid. And for any of you out there that have a grandkid, I have learned what people say. Well, I would jump in front of a bus for this person, or I would give my kidneys to this person. It was all pretty anecdotal 30 years ago, but about 2 years ago, I learned that that's real. That's a real feeling. I didn't know that was a real feeling. I didn't know that was a thing people do or feel. And tomorrow, if that would be the case, I'd be, I had a great life. Check out. This kid needs it. I'm on. It would be the greatest honor of my life to do that for him. So that's a lesson I've learned over the past 2 years that that's why we get up and go out in the morning. That's why we do these things that are sometimes thankless, sometimes dangerous, sometimes not fun, sometimes hard to see. I used to say that this picture here is why I do the job. Now I sometimes say this is why I don't want to do the job, because I want to come home. And I would imagine that after the pandemic, there was some of those feelings for you all. How often can you keep going back to that well and beating your head against a wall? Are you? We see you, okay? We see you. We see what you're doing. We see the work you do. There's not enough money. There's not enough pizza parties. There's not enough Kroger gift cards to say thank you to people like you all that are in those trenches doing the things that need to be done. You ride on the street in a fire truck and people love on you and salute you, and that's great. But that's not what everybody gets, and that's unfortunate. So I'm very. I want to apologize on behalf of those of us that stumbled into that. But yeah, anyway, thank you. So let's talk about trauma. Yay! What is it? It is the lasting emotional response that often results from living through a distressing event. Right. I would also contend that it results from living through a lifetime of distressing events. We're going to see in a minute that there's the acute trauma and the cumulative trauma. I'm going to show a couple little video clips. I may circle back and show some video. I just want to make sure that our time is right and that I over video you guys. The grandkid has also got croup and ear infection. So consequently, I now have whatever the adult version of croup is. So pardon me if I take a sip.
You're doing fine.
I don't know what the adult croup is, but it's not that bad. It's just frustrating more than anything else. So we talk about what is trauma to a first responder, and I include all of us in that. It's a daily occurrence. I will take a moment to show a video just because I think that's kind of a fun way to show some stuff. That way you're not hearing from me all the time. Come here.
We can hear and see.
Very close call for 3 firefighters in Dearborn, Michigan. The roof caved in. Look at this. While they were on top of a burning building, it housed a dry cleaning business. They actually got out just in time. Luckily, no serious injuries either, but a little scary. Wow. Yeah.
All right. So that video, obviously very specific to one industry, but I think we've all had those experiences where we get up and go to work and we assume it's going to be a normal day, and then either actually or metaphorically, the roof caves in on us, and we have to deal with it, right? Hopefully we get out and go home and we get to pick up our families and love on them, but sometimes you don't. And so we have to know that stress in itself of not knowing what's coming is as much of a trauma as the actual trauma itself. So that video, are we addressing this? Are we trained for it? Are we budgeting for it? And it goes back to, you can learn more of an organization's priorities, not from the mission statement, but from a budget. And just like you said earlier, it's a moral document. And I don't think you can say it better than that. All right. So let's talk a little bit about acute trauma. And I'm going to reference myself because I had some experience with this about a year ago. So on October 1st of 22, around 2 in the morning, I was on our way to an apartment fire. It was the real deal. It was 3 stories, fully engulfed. We went in to do a search. Long story short, I got burned. I knew the apartment needed to be searched. I thought the fire was sort of knocked down. I got disoriented a little bit. And as my skin is melting, I had to calm myself and get out a window, and they brought me a ladder and crawled down. I got some. Here's a funny part of the story. So in the ambulance, I'm looking at my hands, right, and they're just blistered. They're all blistered. All 10 fingers are blistered. And the paramedic, who was a guy that I work with, was trying to give me an IV and give me some medicine. And I was thinking, as a mental health practitioner, like, what's going to happen now? I'm going to be. What's my brain going to do? I've never been hurt this way before. And so I asked him, I said, Scott, what's going to happen next? Thinking, wanting him to be there for me in a mental health practitioner sort of way. And he said, well, I'm going to put an IV in and take you to the hospital. And that's all he said. And so at that point, I had to sort of shut up and take the medicine and sit at the hospital for 3 hours and send me home. And they dropped me off on the porch with my partner, and the grandkid was there. And I've got bandages all over me, and nobody knew what to do. And it just, uh, it that sort of trauma is that acute trauma. So in a conceptual sort of way, this is what it looks like. This is the kind of trauma that gets sort of the attention and the services, and this is the trauma we think of when we think of trauma. I would argue that is not the most important types of trauma that's out there. This was a big deal, but it's also not. It's pretty rare, right? That's not the trauma that we're talking about all the time. The most common trauma, cumulative trauma, is sort of the alternative to this, and that's, I think, much more common. But I think it's also much more ignored. This is a much more common experience for all of us. It's much more challenging to address, and I think it's much more insidious because we don't see it coming, and we don't realize that we're experiencing it until we're at home yelling at our partners, or sitting in a dark room drinking more than we should, or putting on a happy face and going to work and coming home and crying at night. Those are the things that are really difficult, I think, to treat, and that's why we're going to talk about it. So cumulative trauma, it builds up over time. It, as I said, goes unnoticed. I think the more stressful the job, the more there's a culture of coping. Those of you that work in either community mental health or go out in the community and see people in substandard housing, or try to get people to do what's right for themselves, what's best for themselves, and then realize that you can't have as much of an impact as you want. That builds up, guys. It really does. So I'm going to ask a question now. So in the chat, if you want to answer this, I asked a coworker of mine a question, and this is the answer they gave me, and I didn't fill in the rest of it. But it was a paramedic I was talking to, and this is the answer he gave me. I am used to blank. Anybody have any ideas what the end of that sentence might be?
Feel free to unmute, fine. Death and despair. It is another question. Death. I was guessing blood and guts. Stress.
You're all pretty close, actually. Yeah, you're all really close. The answer is, I'm used to dead babies, which is a horrible thing to think that this person has to get used to. But that's that gallows humor that has to get this person to the day to get them back on the truck that day. And again, are we all dealing with dead babies all day, every day? Of course we're not. But I don't think the example is lost on this audience, on any audience that has lived through what we've lived through the last 3 or 4 years. Oftentimes this is brought to the surface by something benign, and I'm going to show you a video in a minute, that a 2-minute video that encapsulates the entire thing. You could have skipped this whole hour, watched this 2-minute video, and you would have gotten everything out of it that I'm trying to convey. So, but I'm not going to do it now, because then you'll drop off or start checking email or something. So let's talk about some real life examples, though. Let's talk about a skilled nursing facility that is in need of a specific number of staff to function every day. Staff have been working extra shifts to cover for those that have been quarantined for 2 weeks at a time, because that's, we quarantine from 5 days to 2 weeks if you're out with COVID. Staff members are burnt out; they are fried. I don't care how much of a bonus you're paying them. Sometimes, at some point, the money stops mattering, and people just want to go home. And while our duty is ultimately to our clients, or to the people that are experiencing this trauma, is there an ethical question to consider as it relates to the health and safety of the individuals that are living in these facilities? If we're treating somebody that works in a facility, what might be best for them versus what might be best for the people that they're caring for may not be the same, right? You need to be home with your family for 2 days. You've been worked 8 days in a row. Well, but the facility needs bodies. So that I think that fits both sides of this coin, right? As a clinician, we struggle with helping our clients get to what's best for them. As a victim of trauma, what you need and what you think is best for your people that you care for is often different. And that's where that anxiety comes from. And that's what hurts people. That's what makes people withdraw and go away and not be part of community anymore. I referenced the fire department. I don't know if you all know this, but if somebody calls in sick at the fire department, the person has to be replaced. We don't have an option for not replacing that person. If someone doesn't voluntarily take that overtime, then someone gets mandatoried or mandated to come to work. This means that for an additional 24 hours, that person is away from their family and their obligations and whatever mental health time they had planned for that day. So that does a number on you. I speak from both of these. I've been called in to work. As I said, I'm a director of therapeutic services here, but I've been called in to work a suite to feed people and change people and bathe people multiple times over the past 3 years because we didn't have enough people. And that's not my job, not what I was trained to do, but we needed bodies. I've been mandated to come in and ride a fire truck on days when I had people's birthday parties or holidays. I've been mandated on Christmas before because some jerk called in sick on Christmas Day. That takes a lot of nerve, and that person's retired, obviously, too. We don't let that happen too many times.
That makes sense. And I think we all see some of that in our different ways. Sometimes we're the only, in my case, sometimes before Hannah was on board. So yeah, it's interesting. Yeah, sometimes we have to work.
Well, and what is that that stress, Marcy, of if I don't go in, nothing gets done.
Right.
Yeah, I want to take
But
care of
nothing
myself, but
moves
if I'm at
forward.
home, yeah, and nothing moves forward, and you're at home thinking about it anyway, so you might as well come in and get it done. But the problem is, it's never done. There's always stuff to do. And I would argue that all of you guys, if you're looking across your desks right now, you're taking an hour out of your workday to do this talk, and you're looking at your desk going, I've got purchase orders, I've got budgets, budget season, I've got people to hire, I've got people to fire, I've got policies to write, and I'm listening to this guy talk about trauma. Well, all I'm doing is getting behind. So yeah, it gets on top of itself.
Right. In our chat, we've got healthy boundaries is a must. Very true.
It is, and I would love to talk more about those boundaries because it's well, all right. You bring up something very interesting. Let's talk about boundaries for a second. So you notice that when I got hurt, I didn't have the use of my hands. Okay, and I'm a person that is pretty comfortable taking care of himself and have never really had to be cared for. So I in my house, I have two bathrooms, and one bathroom is hers and one is mine. Well, after I got hurt, I had to get my teeth brushed for me. I had to get my face washed for me. I had to get my food cooked for me, and cooking is my one release relaxation moment. I had to get my bandages done for me. I had to get my medicine given to me. If I could give this group one bit of advice, spend $100 and install a bidet at your home. If you don't know what a bidet is, it's spelled BIDET. Look it up. It will save your relationship. It will save your dignity. It will save. I had one installed about 4 months before I got hurt, and it saved my relationship. But I just if you take nothing else from this video I'm going to show you in a minute, that 2 minutes and the bidet stuff, take that with you. Everything else you can ignore, but those two things you've got to remember those. Yeah, a bidet. Wow, I can't wait to see what the reviews are like for this session.
I still laughed at it, and I knew it was coming.
Oh, you did? Oh, that's funny. Yeah,
I
Marcy's heard
do
me
have
before.
one now because of you. So there you
Oh,
go.
yeah, it's life changing. And I can't wait to potty train the 2-year-old and see what he thinks about that. That'll be fun.
You need an Amazon link. It'd be fun.
Anyway, so other examples of this sort of trauma bind we put our workers in. In May of 2020, 900 meatpacking workers at a Tyson Foods plant in Indiana tested positive for COVID. This represents a 40% infection rate at that plant. However, the plant reopened due to federal executive order because we were protecting these companies from liability if workers got sick or died because we had to keep things in this country moving. Well, imagine being that worker, right? I've got to make money for my family. I'll be fired if I don't go in. I'm going to get sick if I go there. I don't want to die. There's no vaccine yet. That kind of stress. And so let's say they live through it. It's all over. They've got the vaccine. They're alive. Their family's okay. There's no more COVID at the Tyson plant. What do we do with that now? Well, we just ignore it at this point. That cumulative buildup of stuff we have ignored. They are not being given resources any longer. As they were in the moment, right? We gave COVID bonuses when they were working in the moment. We made sure they had access to counseling in the moment, but we don't anymore because we're good. We're back, right? Everybody's good. We're good. Everybody's good. And that to me, I think is the more criminal part of this process. Uh, it's pretty frustrating. All right. Because this occurs over time, it's not noticed by supervisors or by the clinicians that you work with. It's just not noticed because it's the frog boiling in the pot, 1 degree at a time. You don't notice that it's boiling, but you drop a frog in boiling water, like I did with my hands. Everybody notices. That consequently, it's never addressed, and it's expected. It's anticipated that you are going to deal with these things. You were going to see dead babies if you're a paramedic. All right, cool. That's just because that's your job doesn't mean it's easy. And I would argue that this is the trauma victim that would appreciate being engaged. I know when I got hurt, I didn't want to talk to anybody. I didn't want the fire chief coming over. I didn't want my battalion chief coming over. I didn't want to talk to the people I worked with. I wanted to be left alone with the people I cared about. But I would argue that the victim of cumulative trauma would be much more open to intervention than the victim of acute trauma. And I will show you now the best example video ever. And if you want to leave after this, you can. No, don't leave. Please don't.
Can you turn up your volume on it?
What's that?
Can you turn up
Say
the
something.
volume on it?
I can. Thank you.
Thank you.
Now we
So they all left together.
You gonna finish that?
No, why? You actually want more of this stuff?
Not for me. I'm collecting scraps for the puppy.
Oh, didn't you hear?
Hear what?
He was killed this morning.
Oh, no. How?
Thrown in front of a Jeep.
Gee, that's a shame.
Somebody should have tied him up.
Why did let a dog run loose around here anyway?
I'm gonna wash my hair. I'll see you later.
Save some hot water for me.
Where'd he come from?
Nobody knows. He just strolled in here one day. Klinger was feeding him.
See you later. Can I use your nail polish?
Oh, sure. Which color do you want? Peach. Peach? Okay, I think the red look better.
Right this way. We have a lovely table for one with a view of the mosquito netting. Margaret, aren't you staying for the floor show? The cook's going to confess.
Excuse me, please.
Hey, are you okay?
Leave me alone.
Don't you hurry. Let's talk a little.
What do you want?
Well, you look all choked up, and I don't think it's the food.
I don't know what you're talking about. And anyway, it's none of your business.
Might help to talk. Look, 2 ears, no waiting.
Will you stop annoying me?
Fine. I thought something was bothering you, and I wanted to help.
You're always trying to get into my head when there's nothing there.
Look, Margaret, sooner or later, this place gets to everybody.
I don't fall over, Captain. Everything around here will be just fine if there's a little less leaning and a lot more leadership. We need obedience. We need discipline, not this chaos. Doctors like you constantly out of uniform, nurses who don't belong in uniforms, dogs running around loose in camp. They're getting run over by jeeps. Get out of here.
No, your emotions are all churned up. You're not doing yourself a favor keeping a cork on it. Let it out.
Let out what? There is nothing to let out. I'm not churned up. I'm not emotional. If you want to cork something, go cork your mouth. Go, go. Will you just get out? Will you?
Listen, I saw you sneaking food to that dog all week. This morning you got run over. You trying to tell me you're not upset by that?
I've got people dying all around me. You think I get upset because a dog gets run over? Why should I get upset about a little dog?
All right. So again, I think that is the best example ever. That show was MASH, if for those of you that are too young to know what that is. But I think it's a great example of what we do and what you all do all day is you do these difficult, impossible jobs, underfunded, under-resourced, and you do it all day, every day, and you go to work and put a smile on your face, and then something relatively minor happens, and that's the spark that helps us to lose it. And being aware of that, I think, is maybe the key. And then consequently, maybe being aware of that for the people that we take care of too. So here's the question: why don't we get help? I don't want to presume that this group is or is not in counseling. I just finished a round of counseling a couple of weeks ago and haven't started up again. But I didn't do it for a couple of years before that. Why don't we go to counseling? Why aren't we getting the help? Why aren't we making ourselves healthier so that we can help others? My mother used to use the example, even as an adult to this day, that you have to, when you're on an airplane, you put your mask on before you can help anyone else. And I think that's pretty valid. I'm tired of her saying it, but it's pretty valid. Um, so into the chat, what are some reasons that we don't get help?
Feel free to unmute too, folks, if it's easier.
Yeah, that's fine too.
Afraid to ask for it?
Yeah.
Stigma, pride, not wanting to lose our job.
Yep.
We'd rather deal with it ourselves. Yep. Insurance, no money to pay copays, don't have time.
Ugh. Ugh, that's gross. I'm so sorry.
Mm.
I mean, it's all true, but God, I'm so sorry. And this is like this is a group that is aware of that, right? Imagine all the people out there that haven't even gotten that far down the thought process of why we don't get help. But everything you all said is 100% accurate. Um, it just is. Here's another one. Counselors that don't have experience with what we do. How many of you are thinking, well, I have to spend the first 3 sessions telling them what we do and why it's difficult? I think, why is it difficult to sit there and listen to people's problems? That just should make you feel better about yourself because you don't have the same problems. Stop. We trying to explain. Sorry, trying to explain how we do what we do and why we do it is just not. It takes too much time. It's too much effort, and I don't want to work harder than my therapist. I don't want to work harder than my therapist. Speaking of my therapist keeps calling, or my physical therapist that I work with. There's also yes, there's another video we're not going to watch right now. Counselors with no experience, they have to be able to hear about really grotesque experiences. Oh my God, stop. I turn this down.
It happens. So yeah, I imagine that's really a small pool of providers that are able to do that.
I think it is, and honestly, if the provider needs to be open to learning and not just so here's the thing. You want to know about the person, not about the job. Don't be curious about the job. Be curious about the person. I used to work at a restaurant. I was a bartender and the cook. I would come in and we'd both be getting ready for the shift. And he knew I was a responder, and so he would say, "Oh man, give me something gross. What'd you do this week? Give me something crazy. Any good car wrecks? Any good fires? Anybody really sick or distorted or arms cut off or whatever?" And it's all fun and at that time, but that's that sort of voyeuristic view that we need to not be. And again, if that's the experience we're getting while our counselor's working with us, we're not gonna want to do that. But yeah, they got to hear about grotesque experiences. They may have to be comfortable with firearms in a session, especially working with cops or military folks. As we said, that Marcy brought to light. Don't be curious about the job. Be curious about the person. And you guys already gave me a bunch of reasons. We lose count of some of the trauma that we experienced, but we still are carrying that with us. Like, I don't remember the number of times I've done CPR on people. I don't remember all the people I've seen shot, but I am still carrying the effects of that. So it's still there. Yeah, asking for help is tough, and you guys know that more than anybody. So it's 20 of. I'm going to pass on this video for a minute and then come back to it based on time. So because I want to make sure you can watch videos. I can send you the links. I don't need to do it all online here. What's out there for us, right? What's out there for you at your work? What's out there for me at mine? Well, there's the annual physical, right? But here's my question to you. At your annual physical, have they ever asked you questions like, have you had any terrible things at work happen over the last year? Did you participate with the flood that took over your community last year? Did you participate with the tornado that took over your community last year? What's going on at home? How's your home life? How much are you drinking now compared to last year? Have you noticed any problems sleeping this year? I think very rarely our doctors are not asking those questions, especially not our annual physicals. If your organization has a physical requirement, whether that you get an annual checkup, the question I would ask is, who is that doctor or that clinician working for? Who is the client? Their goal is to keep you at work, not to keep you healthy. Again, that's a very jaded way of looking at it, but you have to put butts in seats. You have to get people to work. So yes, they want to make sure you're okay, but they're not going to look too deep, because you're going to find something if you look too deep. We have our EAP, right? That's great. Our EAP is a very valuable thing. I'm not here to trash EAPs, but really, you guys remember, I mean, EAP would come in once a year, tell us about their services, and knowing full well that if a fraction of us are going to use their services, are going to call their number on the card, because if we all call, they lose money, and we get our. Again, the EAP is great, but we have to utilize it. And if we don't trust that it's valuable, then we're not going to use it. And then our company's spending money on something that's not worthwhile. Informal conversations that we have around the kitchen table or the break room or the picnic table outside, all are very valuable. I would argue that's probably more valuable than talking to a counselor at times, talking to people that know what's going on. Debriefings by outside agencies. But I would argue that for acute traumas, we don't want this. But for cumulative trauma, it's never done. And so that's that conflict, that middle part. All right. I am seeing this slide again just because I want to reiterate that first responders, that net has expanded. Every Amazon driver that comes to my house now, I have an entirely new respect for, because of what they did during the pandemic and what they had to do. I mean, it's unthinkable what we've asked them to do. Teachers, I cannot imagine what we've done to our school system with our teachers being overworked to the extent that they are, not being able to hire new people retiring early, and then parents having to deal with it. And again, nobody's doing anything on purpose to hurt anybody, but it's a situation that we have to confront. We have to address it. So looking at it slightly differently, as a clinician, I'm not going to spend a lot of time on this because I don't think a lot of us are providing mental health care necessarily to people, but just want to understand that that our worst day, right, as a clinician is a first responder's every day, right? So we need to tailor our counseling to fit those people, manage their anxiety, process the trauma, look at behavior patterns, right? Making sure that if their behaviors are changing, like, are they managing their substance abuse habits before they go home? Are they going home and imbibing too much? Again, doesn't indicate necessarily alcoholism or concerns, but it is something to note for that person. Something about managing these folks is trying to help them to help themselves. They're used to protecting each other. They're used to knowing what to do to help each other. That is, as a counselor, when you're looking at all of us on this call, or all of us that are these first responders, we're used to taking care of ourselves. We're not used to being taken care of. Hence the bidet. It always comes back to the bidet. Never forget that. Let's see. We'll move through this pretty quickly. So a couple scenarios to consider. That these are the decisions that we sometimes have to make in this world. And I'm going to show a video in a moment that kind of makes this come home a little bit. A medical director tells his paramedics not to perform aerosolizing procedures during COVID responses, essentially doing compressions on somebody's chest, due to the increased risk of infection for staff and others on scene. A paramedic is conflicted, right? They're taught to save lives and they're taught to do the job that they're trained to do. And now they're being told not to because it's a danger to other people. What do you do? A fire captain commits to an incendiary attack on a house fire. It's a report of a rescue in an upstairs bedroom. The crew goes inside to search. The firefighters don't find anybody. After the fire's out, the victim's found in a room that was searched. The captain, the person leading that search, comes to you with symptoms of anxiety and depression. You know, how do you process that with somebody? How do you reassure them that it wasn't their fault? It's almost impossible. I would also ask, are there any of these moral type decisions that you have to make in your world? I would really love to know from your perspectives in the jobs that you have. Do you ever have to make these moral decisions? I'm going to queue up a video while you're thinking of that. And if you want to either unmute or go into the chat, that would be great.
I can think of a few since folks aren't queuing up yet. But one of ours is, during the pandemic was, somebody can't be left alone. The loneliness is getting to them and really causing a mental health problem. Mm. And I, as an advocate, right, I'm not the right person necessarily, but I'm the person that would have shown up for that person. And what do I
Yeah.
do? They might have COVID and they've been out and they don't believe in masking or whatever the case might be. I had several of those situations where it was weighing the risks versus the benefits and my guilt versus, you know, exposure guilt versus what happens if I don't help them. So, yeah.
That's a perfect example. And I think that's an example that you guys deal with every day on some level, maybe not to that severity, but on every day. Here's an example. I have an ex-client of mine that I used to work with. He has a mild intellectual disability, but he lives in Eastern Kentucky. And he's no longer a client, hasn't been for years, but he still reaches out asking for money every couple weeks. And I've got to the point now where I don't send him any money. It's a bad investment. But now he's texting me. He's got 3 kids by 3 different women, that one of his kids is dying and he needs $175 for a hotel room and to get up to Louisville or Lexington or whatever the kid is. I haven't engaged on it yet. How do I say no when I know that's not the right thing to do? Me giving him that money is not going to help him get where he needs to be in life. But if his kid is dying, what do you do? What is the cost benefit? How am I helping? What's the best thing I can do for this person and this child that he clearly doesn't know or doesn't see? But now that the child is dying, somebody called him. So, anything else in the chat, or are people being quiet?
And this
If
is
not, I'll show this video.
Norma says financial mental health that impact college students' academics. So she's kind of there with you with the financial versus mental, and where are we with that?
Yeah, I would love to hear more, but I'm assuming you're talking about people being able to afford school or deciding to stay in school versus drop out because they can't afford it. Is that, Norma, a good way of describing what you're talking about?
Yeah, she says, yeah.
Okay. Yeah.
Having been that person, I get it. Yeah.
Yeah, absolutely. And when are you enabling and when are you helping? I think that's something we all struggle with every day. All right, so let me show this video. The narrator is awesome, if nothing else.
A runaway train is heading towards 5 workers on a railway line. There's no way of warning them, but you're standing near a lever that operates some points. Switch the points, and the train goes down a spur. Trouble is, there's another worker on that bit of track too, but it's 1 fatality instead of 5. Should you do that? Many people think the right thing to do would be to switch the points, to sacrifice 1 to save 5, since that produces the best outcome possible. Now imagine the train heading for the workers again. This time it can only be stopped by pushing a very large man off a bridge. His great bulk would stop the train, but he'd die. Should you do that? Most people say no. But why not? Both thought experiments are cases of sacrificing 1 to save 5. What the trolley problem examines is whether moral decisions are simply about outcomes or about the manner in which you achieve them. Some utilitarians argue that the 2 cases are not importantly different from each other. Both have similar consequences, and consequences are all that really matter. In each case, 1 person dies and 5 are saved, the best option in each harrowing situation. But lots of people say they would switch the points, but they wouldn't push the man off the bridge. Are they simply inconsistent, or are they onto something?
Where's my stuff? Oh, shoot. Huh.
There it is.
I don't know what happened. Anyway, so that video, I think, is something that all of us in our worlds, what makes us unique. I don't think that every business, every job has to deal with that. I'd be curious to hear if that sparks anything for anyone on the chat, and if not, we will move forward as soon as I get back to where we were. All right. So there's our Scenarios.
Go ahead, Leanne.
Well, I was just thinking, yes, on that situation to move the track to where it would hurt one, but you could also hopefully tell that person versus that's just ugly and to push somebody off the bridge versus moving the train and trying to holler and get that person's attention.
Right. Well, what you're describing is not to be a complete science fiction dork, is the Kobayashi Maru from Star Trek's The Wrath of Khan. If you guys are all too young for that, but what essentially happened is there was an unsolvable problem that James Kirk, the captain of the Enterprise, found a way to solve without making either choice, and everybody won. Everything won. Called the Kobayashi Maru. It's a pretty funny reference, but that's exactly what you're describing: is how do we serve both purposes? And I think sometimes it's possible, and sometimes it's not. And to even have to have those conversations is a horror to me, and that's the trauma. Like, let's say you even succeed on solving the problem, you still had to deal with it. We had a nurse that worked here for a long time that worked in pulmonary rehab at U of L Hospital during the pandemic. And at one point, they had to decide which of two patients got the only ECMO machine they had. Was it the pregnant woman or the young guy? And they had to make a choice. Doctors and nurses went into a closed room and made a decision, and essentially decided who was going to live and who was going to die because of the lack of resources. I don't know what you do with that. As the clinician there, I don't know what you do with that. You got to put it someplace deep and dark, and when it's ready to come out, then you address it. It's really I don't know what you do. So thank you for that response. Thank you. All right. So we got 5 minutes left. I want to sort of stop now. I'm going to stop sharing, and just see if there's anything that we want to kind of talk about, and anything that we didn't address. I would love any feedback on things you thought this was going to be, but didn't turn out to be, or there are topics that you wish that we'd gotten to, or things that you want to put in my head for me to talk about that would be valuable to the next group that we talk to about some of this trauma work. I really do value your all's time. I know everybody is busy, and I know your desk is piling up. I know your email inbox is piling up. So anyway, I'm going to stop talking for a minute, see if there's anything else out there that you guys want to talk about. And if not, I just want to say thank you, and I'm really grateful that you gave me this much of your time.
Jim Batson adds, the needs of many outweigh the needs of few or the one, Mr. Spock. So we're not the only Trekkies on the call.
Perfect. I see my email, yes, is at gmail.com. There you go. And I will send it, if any of these slides you want, I will send them to Marcy and Hannah, and they can distribute them if they would like.
Thanks so much for that. Yeah, I think you covered a lot, actually. And I do think that we tend to ignore, at least I do, sometimes the stress of some of the decision making day to day. I think that cumulative stress is definitely something we wanted to highlight. So, and
Thank
that's
you, Marcy.
not just one type of provider. It's all of us, right? So.
Yeah, I think it is. We are all in this. I don't mean to quote Andy Bashir, but we're all in this together. But we are, and I don't think there's any one of us that is any more vital than the other. Because the minute one of us drops out of this mindset, then somebody else has to pick up that load. So I'm grateful for all that you guys are doing, and again that you took time out of the middle of your day to try and increase your skill set or get a different perspective. So I'm really grateful for you guys.